Hello, welcome to any community. In this particular video, we are going to discuss the context of Rupa or Lakshana or the what we can say the clinical features observed in the disease in the diseased individual. So when you discuss about the context of Rupa, actually it is nothing but the what we can say the Lakshana or the clinical features or signs and symptoms observed in the disease in the diseased individual. When you think about the description of Rupa, it is being mentioned by Madhukosha commentary. So Ishwar Sen has mentioned regarding the context of Rupa. Vyadehe Swarupam Yad Vyaktam Tad Rupam. The Vyadehe Swarupam, the nature of the disease, which is being Yad Vyaktam, that means it is considered to be fully manifested, which is not the Avyakta, which is considered to be Pura Rupa. Here it is Vyaktam, that is considered to be Rupa. Madhukosha commentary further says, Tathavida dosha samurchana vishesho dwaradirupo vyadhi tatkaryascha aruchyadaya. So that is Tathavida dosha samurchana vishesho. So that means whenever there is dosha and dushya, they are going to get mixed together. That means the intermixing or mingling of this dosha and dushya. Dosha in the sense the vata, pitta and kapha. Dusha in the sense the dhatu and mala. Prasadi dhatu and shakrid, mutra and swedadi mala. If they are going to get mixed together, that will be resulting in the manifestation of the jvara, etc. diseases. Charaka says, Pradarbhuta Lakshanam Punarlingam. So that is the fully manifested Lakshana. So that is Pradarbhuta Lakshanam. So that is early manifested Lakshanas. They are going to further appear in due course of time. They are being considered as Lingam or Lakshana or Rupa. Utpanna Vyadi Bodhakameva Lingam Rupam. So that is Utpanna Vyadi, that is manifested disease, that is clearly identifiable Lakshana observed during the manifestation of disease, that is being termed as Rupa. Tadeva Vyaktatam Yatam Rupamityabhidiyate. So that is Tadeva here, that is Alpa Vyakta Lakshana. If they are going to get fully manifested in the individuals, they are being termed as Rupa. So, to sum up as such, Rupa, when you think about the Shat Kriya Kala, this will be observed in the fifth stage of Kriya Kala. In the fourth stage, we are going to observe the Purva Rupa. In the fifth stage, we are going to look into the Rupa stage as such. Actually, that is nothing but the fully manifested or well manifested Lakshana or clinical features. They are being termed as Rupa. So this particular manifestation of the Lakshana, that may depend upon the source of the entry of the Nidana. Suppose if the person is taking more amount of the Adhyashana as such, the Lakshana are likely to get manifested in the Mahasrotas first, maybe in the form of either Ajirna or maybe in the form of Alasaka or maybe in the form of Visuchika, etc. Plus the number of Nidana as such or pathogens entering into the human body. Suppose little amount of the Nidana will be leading to milder form of the disease. Large amount of the Nidana intake may lead to severe form of the disease. Virulence of the Nidana. If the very potent Nidana, if it is entering into the body in little quantity, may produce severe symptom. So like that, so the nature of the Lakshana, they are going to get manifested. That depends upon the three factors. Source of the entry of the Nidana and number of Nidana or pathogens entering into the human body and virulence of the pathogen or Nidana entering into the human body. As far as synonyms are concerned, Tatra lingam akritir lakshanam chinnam samsthanam vyanjanam rupam ityanarthantaram. Charaka Nidana says lingam, akriti, Lakshana, Chinha, Samsthana, Vyanjana are considered to be synonyms of Rupa. Ashtanga Hridaya, Nidana Sthana, first chapter says, Samsthanam Vyanjanam Lingam, Lakshanam Chinnam Akritihi. Samsthana, Vyanjana, Lingam, Lakshana, Chinha, and Akriti. So these are the synonyms or paryaya of Rupa. There are no specific types of Rupa are being mentioned in the textbooks. Of course, based on the Lakshana, they are being manifested. There are several criteria are being mentioned to categorize Rupa. So that is most severe symptom. If the person is having the most severe symptom in the sense, the person is the routine activities, they are going to get disturbed. For example, sleep or appetite, that is food intake, etc. They are going to get disturbed. So, or otherwise, the wearing the clothes, etc. So that is if that is being disturbed. Based on that, the Rupa that can be said. For example, Udara. In the sense the person is having the huge abdominal swelling, and thereby the person is not in a position to wear the clothes properly. Atisara. In the sense the person will be passing the liquid stools, so that the person is not in a position to the move outside, etc. if the particular symptom is very severe. Most persistent symptom based on that. For example, in the person suffering from Amla Pitta, the most persistent symptom, Lakshana, that is considered to be Pittodgara and Amlodgara. The person will be having bitter irritations or sore irritations. Breathlessness, that will be observed, or what we can say, the breathing discomfort will be observed in the patient suffering from Tamakashwasa. Most chronic symptom, so that is Kushnate Opurite Kushtam. So that means which is causing the discomfort to the body or twak as such, that is considered to be Kushtha. Presence of Pakshavadha in Pakshaghata. That means the presence of loss of strength in one half of the body, either in the left upper limb or right left lower limb, or right upper limb or right lower limb, etc. That will be observed in the person suffering from Pakshaghata. That is the third criteria, most chronic symptom, widely distributed symptom. So that is the multiple joint affliction in the person suffering from Vatarakta, or what we can say the Kudavata as such, or otherwise Kushtha. So that is the skin afflicted in large area of the, what do you say, that the skin surface as such, then it is widely distributed symptom as such. And fifth criteria, symptom of clinical significance. So that is if the person is suffering from, what do you say, that the Ketaki Dhuli color, then we are going to make the diagnosis of Pandu. Ketaki Dhuli in the sense that is yellowish white discoloration as such. Dark yellowish discoloration of the skin or mutra may be observed when the person is suffering from Kamala. So like that, these are the different criteria where we are going to make the, what do you say, that the diagnosis of the disease based on the Rupa. As far as significance of Rupa is concerned, we can able to identify the probable site of the pathology, which particular part of the body is being afflicted, whether the person is having the Amasha affliction or Pakwasha affliction, or whether the person is having Sandhi affliction, such as Janu Sandhi or Gulfa Sandhi, etc., or whether the person is suffering from the Uras affliction or Udara affliction, or whether the person is having the Jatrurdhva affliction. As such, the probable site of the pathology that can be predicted. Second major aspect, that is Vyadhi Swarupa Jnana. Actually, the nature of the disease that can also be predicted. But actually, whether is it the related to the Vata dosha affliction or Rakta dosha, Rakta Dhatu involvement, etc. And Sadhya Sadhyata of the disease can be predicted. So suppose if the person is having the Hetavaha Puru Rupani, Rupani Alpani Yasyavai. If the person is having the mild form of the Lakshana, then such kind of the disease is considered to be Sukha Sadhya in nature. Mild form in the sense the person is able to do his routine activities. That is what we can say, milder form as such. Nimitta Purva Rupana Rupana Madhyame Bale. If the person is suffering from the Madhyama type of Rupa, in the sense the person is taking the medication. After that, he is going to get relief from the symptoms, Lakshana or Rupa. Then we are going to say such kind of the diseases are considered to be Riksha Sadhya in nature. So, like that, the Sadhya Sadhya of the disease can be predicted based on the presence or absence of Rupa. When you think about the site of the pathology, so here, if the person is having the pain in the umbilical region, in a matter of 3 or 4 hours later, the person is having the pain in the right iliac fossa, then we are going to say the probable site of affliction in this particular location could be appendix. Suppose if the person is suffering from the pain which is radiating from loin to groin, suppose in this particular example, right side, right loin to right groin, then we are going to say there may be a possibility of the affliction of a right ureter, probably ureteric colic. Suppose if the person is having pain which is in the epigastric region, radiating towards the left hypochondric region to the back, then the probable site of the pathology could be pancreas. So like that, the site of the pathology can be predicted based on the Rupa or Lakshana. The Vyadhi Swarupa Jnana. Suppose if the person is having the severe pricking type of pain in this particular region, for example, in the epigastric region, and which is considered to be of short duration, then we are going to make the diagnosis of Shula. Suppose if the person is having the pain in this particular region, so that is what we can say, that is we are going to say there may be a possibility of the urinary bladder affliction, and we may say there may be a possibility of the urinary bladder obstruction if there is any kind of the swelling is being observed in that particular region. And third thing regarding the Sadhya Sadhyana. Suppose the person is suffering from Kushta. In the example one, the person is suffering from Kushta in the very, that localized area in the right upper limb. In the sense, when you think about it, it may take a bit less time duration to have a complete treatment or complete remission of the symptom. Whereas in case of the example two, wherein the skin as such affliction is observed in the large area when you compare the example one. In that particular situation, it may require somewhat the more duration of treatment may be required in example two. So like that, so Sadhya Sadhyata can be predicted based on the nature of the Rupa. When you think about the characters of Rupa, the group of Lakshanas that may indicate the involvement of either one Dushya or multiple Dushya may be observed. For example, if the person is suffering from the itching, etc., then we are going to make the diagnosis of Kushta. In that particular situation, the possible dhatu affliction that we are going to say the person may be suffering from Rakta dhatu affliction. Suppose if the person is having the joint pain of a right knee joint along with swelling, there may be a possibility of affliction of asthi and majja can be predicted. So that means we may say that there may be a possibility of a majja vaha srotas affliction. Srotomula affliction can be said because asthi and sandhi are being afflicted in that particular situation. So like that, the Rupa can be helpful in making the diagnosis. For that, you need to know about the chronology of the development of the Lakshana has to be noted. So that is, initially the person is having the Shirogaurava by taking the Dadhi. Later he is suffering from the Pratishaya if he is continuing the Dadhi Sevana. After that he is getting the what do you say that the Kasa. After that, he is getting the Shwasa. Then we are going to say that chronology of the development of the symptoms by taking the Dadhi as such, that is helpful in making the diagnosis as such. For that, you need to know about the Srotas afflicted first, and you need to know about the pattern identification. Based on that, we have to identify the probable cause of the disease as such. Dear ANA community, that's all for today. What are the major key takeaways from today's discussion? Mention in the comment box below. And what is the one video that you'd like to hear in the coming days in this particular channel? Mention in the comment box below. And spread this particular video to maximum number of 2 Nidana learners so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.